Pacific regional meeting and our media advocacy to action for the Western Pacific. It's terrific to see you all. As I was just saying, as some people were joining, it was really nice to see so many people from the Western Pacific in Singapore a few weeks ago. I think we had over 100 people there. And so many of you were part of that Western Pacific contingent. But of course, after a little bit of downtime, the work doesn't end, and we're now moving into the second half of the year, and so it's important to give you a little bit of an update on what's happening in our Western Pacific region, but also to think about some of the global work that's happening and how some of that translates to the regional level. And also to think about some of the advocacy networks that we've started talking about as we implement 2030 Insight. But before we get into that, I would like to say a big welcome to our guest speakers today. So there will be further introductions as we move through the program, but big warm welcome to our guest moderator, Holden Kim, to our presenters, Dr. Alma Nathuvu from Fiji, to Dr. Lasila Arching Sefo from Samoa, and to our regional chair, Amanda Davis, who has very bravely agreed to do an Ask IAPB Anything session as part of today's advocacy to action. Of course, we also have some of the IAPB team who are going to be doing some short presentations. Junu Shresha, who is our knowledge manager from Nepal, and Rachel Burke, who is our membership manager from London. So welcome, everybody. Without further ado, I'm going to hand over to Junu to give us the global advocacy update. Welcome, Junu.
Hi, everyone. Thank you so much, Drew, for introducing me. Let me share my screen and have a very short update on what's happening in the global policy in eye health. Yeah, I hope my slides are visible to you.
Oh, good. Thanks, Junu.
Yeah, great. Let me have this in presenters. So Drew, could you please let me know, is the slide visible, or there are a lot of other slides as well at the same time?
It's visible, but it's not on presentation mode, so we can see all your slides.
Okay.
That's better. That's good.
Yeah, thank you so much. Yeah. So this is the second regional update session for the Western Pacific. So in the first one, I was in Geneva to participate at the World Health Organization Executive Board. And in this, in between the January and now, so we have participated in the World Health Assembly in Geneva, which was from 21st to 30th of May this year. So the World Health Assembly is the highest health policy setting body of the world, which is composed of health ministers from 194 countries. And at that assembly, IAPB, we presented the first ever group statement among the member states meeting under the agenda of the prevention and control of the non-communicable diseases. So we highlighted the conditions of eye, such as type retinopathy, glaucoma, age-related macular degeneration, complications of high myopia, and rare eye diseases. So our statement urged member states to strengthen healthcare services to ensure timely diagnosis and treatment to prevent potential vision loss by integrating eye care within the healthcare system. So that constituency, the group statement, was supported by other 7 non-state actors in relation with the World Health Organization. The next coming up is the refractive error resolution. IAPB is supporting the process for a World Health Assembly resolution on the refractive error in next year World Health Assembly, that is in May 2024. So as we all know, that refractive error and myopia is a growing public health issue, and the half of the world's population is predicted to be myopic in 2050. So in order to tackle that situation and also to respond the call to action on the WHO's World Report on Vision, which was launched in 2019, the World Health Assembly resolution, integrate people-centered eye care, and also the first ever United Nations General Assembly resolution on eye health, that was Vision for Everyone. And the global target, which the countries adopted on effective coverage of refractive error at the 74th World Health Assembly in 2021. So to respond to all of this and also the growing burden of refractive error, we are supporting a World Health Assembly resolution in next year. And at the moment, we are having a very strong support from Malaysia and Singapore for the resolution in leading and also in co-sponsoring the resolution. So the next one is the SPECS initiative. WHO is developing a new initiative on refractive error SPECS to support countries in achieving the World Health Assembly endorsed 2030 target on in effective coverage of refractive error. This initiative is aimed to develop technical guidance to facilitate integration of refractive error services and provide platform for stakeholders to promote united action and coordinated advocacy for the target on refractive error. So some of the trials for developing this initiative were conducted with the IAPP Western Pacific members in South Korea. So this initiative will be launched in next year. The SPECS is also an abbreviated form for the 5 strategic pillars, so which are developing innovative models of screening and delivery of spectacles, support the training of professionals, improve eye health education, public education targeting the prevention and management of refractive error, reducing the cost of optical services, and ensuring robust surveillance and monitoring of effective coverage of refractive error. For those who were in Singapore 2030 Insight Live, WHO also presented a session on SPECS and also in the IAPP board meeting in June this year. The next one is Advocacy for Eye Health, a beginner's guide. This year at IAPB, we are developing a beginner's guide, which is basically aimed to the beginners in advocacy who want to advance eye health policy and outcomes in the country by driving the change through government and institutions. So this is a very short, brief guide in a simple language, which talks about what advocacy is, how to make a powerful case in eye health, and building an effective advocacy project, some advocacy messages, and very useful tips and tricks for successful advocacy. So this advocacy guide will be released very soon. So this is in the design finalization stage, and we are hoping that this will be up very early next week. So please keep tuned on IAPP's Advocacy to Action website for that. So as a part of collaboration with International Labour Organization, we did a collaboration with ILO this year to write a joint policy brief on eye health and the world of work. So the brief is going to be launched on 5th of September this year in Geneva, the International Labour Organization's headquarters. So this collaboration is the eye health's work to showcase the impact of eye health and the productivity and the employee and employer's eye health. So to highlight that, we have also this year's World Sight Day theme as Love Your Eyes at Work. And I'd like to hand over Rachel Brook, our membership manager, to talk briefly about this Love Your Eyes at Work and World Sight Day this year. Thank you so much, Ru.
Thanks, Juno. Hi, everyone. Yes, so just a quick verbal update for me on World Sight Day. As Juno mentioned on our slides there, this year's theme, you might have already seen it, is Love Your Eyes at Work. World Sight Day is taking place on Thursday, the 12th of October this year, and we're really focusing on employers looking after employee eye health. We've created different activations for members to get involved in, which I just kind of want to run through with you. And if you're interested in getting involved at all, if you've got any more questions afterwards, I'll put my email address in the chat box, and please do get in touch with me because we'd love to get as many people involved as possible. So the first activation I'd like to talk about is our global challenge this year. So you might remember from the past couple of years, we've had global challenges where members got involved and done screening in different locations or in unique and diverse settings around the world, or parliamentary screenings in different countries. So this year, to go along with the theme of the workplace, we are asking members, which we know a lot of people already do, to conduct screenings in different workplaces in the lead up to World Sight Day. And then on the day itself, we'll promote it across all our channels and hopefully reach a wider audience. So if you are conducting any screenings in workplaces, or if you want any more information on that, I can share with you some details. And we're looking at kind of more different and interesting across as many countries as possible, the better. And we've also got a lot of resources. So we've got all the resources, the posters, the logos, the social media resources that we've had in previous years, which we've built upon this year. We've also got specific workplace resources, and we can share those with you after this talk today. And also, I just wanted to mention to you about the pledge. So you may recall the past 2 years, we had our pledge target of 1 million screenings, and asking everybody to pledge any screenings that they're doing in the month leading up to World Sight Day. Last year was 3 million. This year, we have increased that to 10 million, which is wildly ambitious. And we've extended the window for this to the 100 days leading up to World Sight Day. So from the 4th of July to the 12th of October, if you are able to provide us with an estimate of the number of screenings or surgeries that you're doing in that time period, please do let us know, because it's really important we get everybody involved in this. It's going to be a huge media moment for us all if we're able to achieve that goal. So again, please do send over your pledges to me. I'll put all my details in the chat there, and we'll follow up with you afterwards. So if you have any questions, do get in touch. Thank you.
Thank you, Rachel, and thank you, Junu, for the update. As I mentioned in my opening spiel, there is a lot happening, and we sometimes forget when we have the big events like Singapore that the work continues. But I know, talking to the team this week, how much work's being done at a global level in Geneva and New York, and we saw that from Junu, and of course in our sector, how much work is being done in the lead up to World Sight Day. So just to really reiterate Rachel's point there about supporting the World Sight Day activities and submitting those screening numbers, because it will be amazing if we reach that 10 million target. And also a little bit of an encouragement for this region. Last year, as Rachel mentioned, we had a target of 3 million. In this region alone, we did 2 million. We had huge numbers from countries all across the region. And in fact, in this region, from Malaysia, we had the only pledge by a Ministry of Health across the entire globe. So it's really exciting, World Sight Day for our region. It's also the region that first sees the new day. So many of you in the Pacific Islands and in New Zealand are amongst the first countries to get involved in World Sight Day activities on that second Thursday in October. So really, please get involved. Now, today is also about advocacy to action, and I wanted to talk a little bit about the advocacy networks that some of you were asking me about in Singapore, and that will start to become a little bit more apparent as we move through the end of this year and into the new year. One of the big requests that we have had at IAPB as a result of the launch of the 2030 Insight strategy, and as we start to talk about the implementation of the strategy, is how do we as a group do a better job of sharing information and supporting each other? So we're quite good at sort of transforming the messages from a global level to a regional level or a national level, and we're quite good at sending the messages back the other way. But how do we do better at cross-sharing? And in many countries, we have national prevention of blindness committees, and we have Vision 2020 committees, and they do a fantastic job. But they tend to be a little bit siloed on a national basis. And so one of the things that we have also been asked about is how do we set up some advocacy networks that stretch across borders amongst like-minded people in countries that are dealing with very similar issues. And so we're grappling with this at the moment in the Western Pacific, but not just in the Western Pacific, or all across the world. I was very lucky in the week before the Singapore meeting to attend the PACI's meeting in Suva in Fiji, and I think it's really important to highlight what a terrific meeting that was, because we've been very focused on the successes of 2030 Inside in Singapore, and it's overshadowed a little bit all of the great work that was being done in the Pacific Islands at the PACI's meeting. That PACI's meeting is held every 2 years, and it was a fantastic opportunity for the first time since COVID to meet all of the Pacific Island practitioners again. But one of the things that we talked about quite a lot at that meeting was how do we get better at communicating again across the islands, sharing experiences, sharing ideas, sharing the sort of information that is discussed in these meetings about translating the global activity to a national level. But not everybody always has the opportunity to attend these meetings. So what can we do about that? And happily, Dr. Alma, who is the new president of PACI's and who's joined us today, and I have been able to have some initial conversations about that. So that's a case of watch this space. But I'm very, very interested to hear from anyone who is interested in being part of a cross-national or regional or even national advocacy group. We're still framing the idea, and so we're interested in people's thoughts. It's not to tread on the toes of existing bodies. It's not to get in the way of national committees, but it is so that those national bodies and committees can share information and best practice and even lessons learned between each other. So that's a little bit of a theme that's going to be running through today. You will notice that our advocacy meetings have become more intimate, and that's quite a deliberate tactic to attract the people who want to be part of a group and a discussion and a little bit more interactive in these conversations. So that's it from me for the moment. I am now going to hand over to our guest moderator, Holden Kim. Holden, many of you have already met. Holden is one of our most engaged members in the region. He is the CEO of LabSD, which is an eye health technology focused company that is based in Seoul in South Korea, and Holden works all across the region, particularly in the Mekong countries and also in Papua New Guinea, but also across the globe in countries as diverse as Malawi and India. So Holden, I'm going to hand over to you and leave it to you to take away the discussion with our guests.
Okay, thank you very much, Drew, for the introduction. Since you took my opportunity to introduce myself, I will take our distinguished speakers opportunity to introduce themselves. I'll be introducing them. Okay, so we have 4 speakers today. First is Dr. Lucilla Aching Sepho. She's a Chief Ophthalmologist of Samoa and newly elected Deputy President of PACI's. Congratulations, Doctor. And Dr. Lucilla has been involved with PACI's and eye health advocacy for many years, and she will be talking about some of her experiences. And there's also Dr. Arma Natuvu, from Suva in Fiji Islands, where she works at the Pacific Eye Institute and the Suva Colonial War Memorial Hospital. Dr. Alma is newly appointed president of PACI's. Congratulations again. And she will be telling us a little about her vision for the coming years. We have 2 Amandas amongst the speakers. Amanda Hong is Fred Hollows Foundation country manager in China. She will be talking to us about her advocacy experiences in her role in China and also in the broader region. And lastly, there's Amanda, we can ask IAPB anything. Oh, wow, that's going to be a tough session. There's no one who better can answer our questions. So Amanda Davis, the regional chair of the Western Pacific region, will be joining us today. Okay, so I guess our first speaker would be Dr. Alma Nakuva. We're going to be talking about the advocacy needs in Pacific Islands, and I believe there's no better person to speak about this than Dr. Alma Nakuva. Dr. Nakuva, could you please share with us today about the activities that PAC Eyes is doing in the region, and what are your plans over the next couple of years? You can share presentation if there is any.
Thank you, Holden, and thank you, Drew, for this opportunity for me to join this webinar. This is my first time. Just briefly, I trained with the Pacific Eye Institute and I graduated a couple of years ago. So this is my first month as president of the Pacific Eye Care Society. And this is actually the first time for me to be speaking on such a forum. My work is purely clinical, and this is a new area for me to be delving into, although it seems very interesting and I know it's very important. But I'm very thankful for this opportunity for PAC Eyes to be represented at this forum. So just briefly, for the Pacific Eye Care Society came about as a recommendation as a result of a meeting that happened back in 2002 and 2003 between certain NGOs, which included Fred Howes Foundation New Zealand and some local and regional doctors. And as a result of that first meeting, there were two recommendations. One, to establish a professional body that was representative of Pacific Eye healthcare workers in the region. And number two, to establish a training institute within the Pacific that would train the eye healthcare providers in the Pacific. And that would include ophthalmologists, nurses, and the technicians. And Fred Howes Foundation New Zealand brought forth that initiative, and that resulted in the establishment of the Pacific Eye Institute, which is our training institute in the Pacific. And also that also brought about the establishment of the Pacific Eye Care Society. So the Pacific Eye Care Society, it's comprised of Pacific eye healthcare providers who most have been trained from the Pacific Eye Institute, and that includes ophthalmologists, nurses, and technicians. And the idea was to have a body that would be representative of the voice of the Pacific. And because we have similar issues, similar backgrounds, similar obstacles, although unique to each one of us, it was similar enough that we collectively, we could be a voice to our national heads, we could be a voice to stakeholders, we could be a voice to and at the international level. So that was the idea of bringing PAC Eyes, but into, forming the Pacific Eye Care. So the Pacific Eye Care Society was established formally in 2003, but it was legally registered formally in 2013. And our regional eye healthcare conference that we just held back in June represented 20 years of our society since it started. And essentially, as we have come forth, we have recognized a few successes. And some of the successes have been that we have become more recognized at not only the regional, but also at the international level. And this is thanks to our very strong support from our stakeholders. And that includes Fred Howes Foundation New Zealand, the Pacific Eye Institute, IAPB, and the South Pacific Community, SPC. And something that came forth strongly after our regional conference was that there is a need for Pacific Eye Care Society to restructure itself in terms of its its governing structure, in terms of its strategic plan. We felt there was a need to change that and have sit down and develop, make perhaps a new vision and a new mission and goals that allowed us to plan better for the next 5 to 10, 15 years. So a major objective for us in the next 3 months is that restructuring process. But at the heart of that is about us helping each other in the Pacific and it's about eye health service, primary eye health service, secondary eye health service, tertiary eye health service, and it's about how can we improve eye health service equality. We have very limited human resources. We don't have much funding in terms of what we are given to provide our services. But how are we able to ensure that our people have equal access to the services that we provide? So that is something that we are looking at, and it's something that is at the heart of us, because most of us, we work for our ministries, we work for our governments, and so just representing the voices of our people, it's about equal access to eye healthcare services that are being provided in our settings. And for some of our people, they only have access to primary healthcare. Some, they have access to only secondary, and there's the few who have access to tertiary. So for us, it's about how can Pacific Eye Care Society help in strengthening the systems that we have in our countries to be able to bridge those gaps in terms of helping our people reach these levels of eye healthcare services. So that's our heartbeat at the moment. How can we bring that to life? How can we plan to help our people in terms of eye health service equality? Thank you.
Thank you very much, Dr. Nathuva, for sharing. And I just have learned that Dr. Lucilla Aton-Sefo is not with us today because of the technical difficulties with the internet. So we will go on to Amanda Hong first, and maybe we can get back to Lucilla later when she joins, if she joins. So Amanda Hong, regarding the gender equity advocacy, IAPB and the eye health sector recently had a global event 2030 in Sight Life in Singapore, where you were one of the eminent speakers in the session. Leaders' lessons to catalyze change. Could you please share about your experience and the learning from the gender equity session?
Thank you very much, Holden, for the question. Actually, if allowed, I would like to start maybe a bit back to the advocacy journey we have in China and how we have been evolved from just focus on eye health alone, but now becoming more broadly to integrate more social elements in our advocacy plans. So the Fred Rose Foundation in China, we have been doing advocacy work, have standalone government engagement and advocacy project for 10 years by now. And we have been taking a comprehensive approach, both top-down and bottom-up, to strengthen both the advocacy capacity at national and provincial level, but using evidence-based approach to demonstrate what is the feasible model that we can demonstrate to the government, and therefore they can integrate into their agenda. So, for example, since 2006, we have been, 2016, we have been collaborating with National Health Commission for a joint national blindness prevention management course for 7 years already. And this is an annual opportunity that we can get together both the national stakeholder and also representative from all the provinces across China to talk about eye health planning and the management issues in China. And one of the long-standing agenda is to talk about the development, implementation, and also monitoring of our national eye care plan since 2006. So by now we have our 14th national 5-year eye health plan, and very soon, starting from next year, we will discuss the 15th national eye health plan. And also this national event also provide an opportunity for us as an international organization to linking agenda from WHO or IAPB into the national advocacy and also eye health plans. So this is the top-down approach we are taking. And the bottom-up approach, we are doing different pilot program in China with different focuses. And by doing this different pilot, we are trying to elaborate the evidence-based lessons and also models that we can integrate different eye health or health agenda that the government is prioritizing in China. And back to your point about gender equity. So starting from recent 3 years, we start to look at how we can integrate eye health into more broad health agenda and also more broad social development agenda. So recently we have been piloting gender equity and inclusion health project in China, looking at opportunities of using eye health as an entry point to address more equity and inclusion barriers for women and children access eye health and health care in China. And similarly, we have also engaging with healthy aging sectors to look at what are the gaps and what are the opportunities that we use, again, as an example, to look at healthy aging plans and also address the issue from a more holistic approach. And similarly, we have been doing school eye health in China for a few years. And this also brings similar with women and children's development sectors to bring eye health into a more social focused priorities rather than before 10 years before we frame eye health as a very clinical or medical agenda in China. So this is really a learning by doing process for us. And we are very proud that saying that in gender equity and the inclusion sector, the foundation has developed the very first gender equitable eye care training curriculum that has been endorsed firstly at the provincial level. And now we are looking for opportunity to scale up into multiple provinces and set up national collaboration with Whole China Women's Federation. So thank you, Holden. And also thank you for the opportunity to share a bit of our advocacy journey and the learnings we have gone over the past decade.
Thank you very much, Amanda. Next will be Ms. Amanda Davis. And we have, as a IAPB's Western Pacific Regional Chair, we have 2 big questions. The question number 1 is, as the IAPB Chair for the Western Pacific, could you please share about advocacy activities in the region? And I just wonder if you are seeing an advocacy network in the region could support in such activities. The second question would be, it would be great to hear about IAPBs or your thoughts on creating and mobilizing such network in the region to translate the global commitments to the region and the countries.
Thank you, Holden, for those very simple questions. So it's a really interesting question. And I think as Drew mentioned, there's been advocacy networks existing in many of the countries, really strong advocacy networks over the years. There was, going back when the Vision 2020 initiative was established, there was many Vision 2020 bodies that were established at that time. of which key to that was also thinking about advocacy around those goals. And so our members are both engaged in individual advocacy. Most of our members will work at some level in advocacy at a country level, and then also working through more structured groups such as your prevention of blindness committees or eye care working groups or Vision 2020 body, whatever they are potentially called. I do think there's room and there's scope for advocacy networks. I think we do have to question too much duplication and where we need to rationalize that. I mean, a big part of the role of IPB in the region is to provide learnings, is to sort of facilitate members coming together and sharing that. So I think that around potentially quite specific areas, so the intent of the advocacy is quite well spelled out, I think that could potentially make sense. Just hearing Dr. Alma talk about PACIs and what unites the Pacific Islands. So whilst you've got island nations, there's a number of issues that unite them, of which it may make sense for them to come together in an advocacy network for both for learnings, but also for advocacy. I think the other interesting part and the other opportunity is also thinking around that broader integration, as Amanda Huang was just talking about, thinking around sort of gender. Maybe our advocacy networks need to extend beyond eye health and be thinking about, more collaborative advocacy networks. Who else are we bringing into those advocacy networks to have sort of bigger impact? So I do think that there's potentially scope. I'm glad to hear that there's sort of quite a big consultation process to think about this without us just sort of reacting and setting these things up without really thinking through them. In terms of actual advocacy that's happening at the moment in the region, there's a few examples, and one of those is actually around the CHOGM meeting that's coming up in Samoa next year, 2024. And actually Drew's leading on from IAPB in the region, sort of bringing together sort of the relevant people to think about what should that advocacy strategy look like. And that's sort of being developed and will be rolled out. So I think that's an example of potentially a regional advocacy network. It will be brought together for that specific purpose, and it's done its job. One of the things I think sometimes in the sector we're very good at is setting up networks or working groups and things that just go on and on and on, and they never seem to end. So I'm a big fan of being task orientated and being quite specific about what you're trying to achieve. And I think advocacy networks should be no different, be very clear on what you're trying to achieve. Junu mentioned the World Health Assembly resolution, of which Malaysia is looking to support that, which is a critical thing obviously happening in the region as well. And then there's sort of like some more sort of integrated work that will require advocacy. Potentially do we bring them together as a region? We'll have to think about that. One of those, of course, is that WHO specs strategy. Obviously, refractive error is a critical issue in our region, more so than anywhere. So that will become a really important discussion for our region going forward. How do we engage with that? And one of the strands of work that WHO is talking about is, in fact, a member network. So what does that look like for us? If there's normative work that's being developed through WHO, what is our role as members of IPB, as a group, membership group under IPB, for advocating for those sorts of changes, for advocating up to member states to implement tools, to think about the targets, the EREC targets. So I think that there's sort of quite a big body of work that will be coming up in the region and will make us think a little bit differently about the advocacy. In this case, we're not advocating to WHO to do this because they're already on board. It'll be thinking about how do we take those global pieces and be advocating at national and potentially regional levels as well. And the other thing which is sort of kicking off quite a lot, which is once again an issue in this region, as it is everywhere, is quality. So particularly focusing initially on cataract quality. And so that's a big discussion. There was a meeting that was held in Singapore. So that is obviously something that working with WHO, who have now basically agreed that they want to be developing a competency framework. Then what does a sector collective approach look like? How do we then come together with what is our ask, what are our key messages for governments, and how do we share those across the region? So I think that I don't think there's one answer. I think it depends on what we're advocating for, and be very then cautious about how we're establishing a network to respond to that particular piece of work.
Thank you very much, Amanda. There actually is a question from the audience, and the question is, what was your number one takeout from the 2030 Insight Live in Singapore?
The takeout from the conference?
Yeah, from the conference.
I think one of the things that was really obvious, it was obvious to this region, it was obvious globally, is the amount of work that's being done by members. It's the amount of evidence that's been created. There was more work than could be fit into the agenda or the sessions. The sessions were jam-packed, which is great. I mean, there was no struggling to find content. But one of the things, and this has probably been a bit of an impact of COVID, is we have to a degree a level of coordinated effort, but I think we need to look and go to that next phase of a collective effort, and what does that look like? And so that's really not members just sharing what they're doing, but members coming together and having one collective approach to a particular problem. And we're starting to see, I think, the beginnings of that in a number of areas, but for me, that was the takeaway. There's not a lot of examples where you've got different member organisation putting their sort of egos and their own needs at the door and coming together to solve a big problem. And I would think that's our next step, and that was my big takeaway of what's missing still in the sector.
Okay, and this is a question for Alma. What is your number one advocacy need in Pacific?
In the Pacific Islands?
Oh, actually, this is a question for Alma.
Oh, it's a question for Alma. Sorry.
It's okay.
Thank you, Alma.
Sorry, can you repeat the question? Sorry.
Yeah. The question was, what is your number one advocacy need in Pacific? What do you need the most regarding advocacy? I'm sure there are a lot of needs going on there.
Yes, we have a lot of need. Okay, so from I don't know if this is personal or not, but just based on something that I'm seeing in the clinic, and just based on something that I've been discussing with one of our consultants in terms of maybe this is something we need to address in terms of a study proper, is making sure that children, like how do we make sure, I mean, advocating for children when they're coming out of what we call kindergarten or preschool, as they go into first grade, making sure that they have no uncorrected refractive error. Well, that's just because what I see in the clinic is that we have children coming into high school with uncorrected refractive error. And I just know that somehow this strongly impacts on their performance. It affects your motivation and your ability to perform well, and it affects them when they come out of high school, and it just sort of takes away these opportunities to do well and be someone who can do well and get into college and be competitive for college. So for me personally, I've been talking with one of our consultants and I've been saying, how can we have a program that where we ensure we have a policy that makes sure that children, when they're coming out of kindergarten or preschool, have the best vision they can have going into first grade and so forth. So that's just something I think something I would advocate for. That's just one. Does that answer the
Yes,
question?
I believe so. Yeah, there need to be emphasis on the correction of the reflective error before kids are joining the school, and it highly impacts their performance at school, as well as I think like it also affects the attendance as well and everything that is related to academic performance. So, and it's easily preventable as well. So I think it's like a really,
Yes.
really efficient way of interventing. Okay, there also is a question for Amanda. You mentioned that members need to put ego aside. Thank you for highlighting that. And can you give me example of a excellent collaboration?
Sorry, I just better take myself off mute. That might help. I can give you the, let me give you the example of one that is commencing, which I just mentioned, around the quality, looking at quality work. So that has been an initial collaboration of a number of our members, working with IPB and also working with WHO. And I think one of the critical parts of this was the members actually reviewing their own results and working with their partners to try to understand the extent of the quality problem, and also to understand the drivers. So whilst there's quite a bit of data, and that was presented in Singapore, that shows the poor quality globally, it's always been a difficult thing, particularly for NGOs, to reveal when they haven't been successful. So sometimes it's talking about what isn't working is actually sometimes more helpful than what is working. And so I think that has been a really good example of coming together. And I think it's illustrating that problem and working with WHO, who have now said that they will be developing the basic competency framework for cataract surgery, and it will build from there. But I think that first step of that real sort of honesty of where we're at and why this is not optimal has been a critical pathway to be able to start this journey.
Thank you very much, Amanda. And Dr. Taylor, I saw your hand up. Do you have anything to ask to the speakers?
Thank you very much, Holden. It was just a comment about, the question of if you're advocating for something, what's the single most important thing? Based on our experience with working with the Aboriginal and Torres Strait Islander people in Australia, we looked at it and said that the pathway of care, or the patient journey for eye care, was like a leaky pipe. There were lots of cracks and leaks where people fall out of the system, and you needed to do something to address each one of those leaks. If you only did one or two things, the pipe was still leaking. We in Australia identified 42 things that had to be addressed. So it's a complex issue. So it's not just saying, well, let's focus on glasses for kids, or let's focus on cataract surgery for the elderly, or let's make sure we train more eye care staff, or we get cheaper glasses. There are actually lots and lots of things that need to be done. And building that complex picture actually provides a very powerful discussion for advocacy, because you're showing that you've really look through the system using that health services research. So looking at the patient journey or the pathway of care. Thank you.
Thank you for the
And
comment, Dr. Taylor.
yeah, there was a couple of really good sessions in Singapore around exactly what you're talking about, that sort of systems-based thinking. It's not, you can't just pick off one thing. There's, you know, a whole system that you've got to think of, or the patient journey, if that's the way you want to look at it. And if I can also just mention, I mean, obviously you tackled that many years ago and have provided the updated reports and shown where the pipe was fixed, where the pipe's still leaky, and what have been the impacts. And I think that's been a critical part of taking decision makers on the journey and ensuring that the right investment was still there, and that, you know, the different policies and things are being put in place, and also the actions at that level. So I think that's a really good example. And I have to say, I have dug out your original leaky pipe diagram a number of times to show how that sort of really demonstrates that level of thinking. And I think that's for anyone who's not familiar with it, it's a very good tool to think through what an advocacy journey would look like, by being able to frame the whole of issue.
Thank you very much. I wonder if anyone else has any questions or comments to the speakers or IAPB. You may just hop in if you have any questions. No questions? Okay, then I assume that.
Amanda's got her hand up.
Thank you. Sorry, Holden, if I may. As part of the speaker, I do have a question maybe to Amanda Davis or Juno about some tools to facilitate the translation of the work we're doing in country, how it can be more appealing to our government decision makers and also donors in terms of translating eye health outcome to more social and economic impact scope.
I'll let Juno talk to some of the tools in the advocacy toolkit, but also just to flag, and I'm a big advocate for this, is the IPB Vision Atlas that actually takes some complex messages and boils that down. Someone recently told me that when you speak to governments and policymakers, you only need to use language for 12-year-olds. I'm not sure that's exactly right, but I'm not saying the Vision Atlas is targeted at 12-year-olds, but there's some beautiful graphics, beautiful slides, really nice distilled messaging, which not just talks about sort of prevalence data, it goes all the way to sort of economic and social impact as well. But in terms of specific tools, I'll let Julia answer that.
Yeah, thank you so much, Amanda, and thank you so much, Amanda, for the question. So yeah, Vision Atlas, as Amanda told, it's all about evidence and how eye health is linked with other social, economic, and development issues. But specifically on the tools, this year we have developed an advocacy for eye health beginners guide, and also a guidance for the countries and reporting VNR, which is also the voluntary national reviews at the United Nations. So it also includes the link of eye health with other the sustainable development goals. So it can be related, the tool can be related with in other countries also, to present the evidence of eye health and its link with other issues, other social, economic, and development issues. And specifically for implementation of integrated people-centered eye care, the advocacy team has prepared last year a toolkit that helps everyone in eye health who wants to advocate for implementation of the integrated people-centered eye care. The whole of the package is in the toolkit. It also includes all the link to the WHO resources and the UN resources as well. So the IPEC toolkit, the advocacy for guide toolkit, and the guidelines for the member states and the IAPB members for reporting the eye health in the voluntary national review. So these are the specific tools and guides which are available now. And yeah, if you need any of those, please, I'll share my email to you in the chat, and I can share those tools with you, Amanda.
Thank you. Thank you both.
Thank you very much. If there's no further question or comments, I think we will be concluding the session today.
Thank you very much, Holden, and thank you for graciously taking on the moderator role of that discussion. It was a great discussion. Thank you very much to Dr. Alma, to Amanda Huang, and to Amanda Davis. I think the discussion today really highlighted the points about sharing sharing information on the advocacy journey. Already, we see some reminders of points like the leaky pipe. We saw some information shared in the chat about the Pacific Health Ministers meeting that's coming up. We heard very interestingly from Dr. Alma about how in the Pacific, the mission of PACIs is around helping each other. And I think that's a great reminder of putting people at the center of the work that we do. And we heard from Amanda Huang about the step-by-step approach that's been taken to start with eye health, but then move into the cross-cutting issues, which is a great reminder to us of the point that Amanda Davis was making about being cautious as we move forward and not trying to reinvent the wheel, but taking things one step at a time. So thank you all very much for being part of this Western Pacific Advocacy to Action meeting. Please do drop any of us a line if you have any questions about anything that's being discussed today. And I look forward to seeing you all around the region in the coming weeks and months. Thank you.